hour and 14 minutes.
Oh, God.
Then where are you jetting off to?
Home.
Oh, okay.
We're now with a live judge. Judge
Huh.
Zoney, thank you for joining us, and safe
Thank you.
safe travels back home. We're
Thank you.
taking up H 876, and Ben Novogowski, our legislative counsel, is home very ill today and is unable to testify. But we'd love to hear any of your comments on any parts of H, of the miscellaneous amendments to corrections laws bill.
So, Tom Zone, Chief Superior Judge, the bill, as I look at it, is in large part its policy decisions for the legislature. They are determinations that the legislature would be looking at and making. As far as impacts on the courts, I don't see a significant impact on the courts per se. Obviously, issues of credit for good time and information about that is something that does tie into the courts. It's information for those involved in the system, victims, as well as the judges to be aware of. And in terms of those policies, they're ones that certainly the court understands. In terms of the actual statutory language issues, one thing that did strike me, and I guess on page 13 of the bill, it talks about a study committee on lines 18 and 19. And this language is repeated in several sections of the committee, but it talks about greater family-friendly visitation methods for all inmates who identify as parents, guardians, and parents with visitation rights. And it just struck me that the last clause might not be necessary. I don't know the reason it said parents with visitation rights, because it would seem to me that would be encompassed in parents. But it's not a big point. There is a point in the bill that talks about the participation in section 7 for an out-of-state correctional facilities transition report, and it requires the judiciary to work with the Department of Corrections, and I would certainly be working with them in any way that they would find helpful. But that's about all I have on the bill. It again.
How many times, do you remember how many times in the past we've studied this?
I do not. I do not have that information. I actually, that may have been a Judge Grierson. He might know more about that. It has not been since I started 2 years ago.
Okay. I'm just troubled by another report that until we can get our population under control or build a huge detention facility, there's no way to bring everybody back. So I don't know what the need for the report is. My opinion is I can give you the report right now from here. There's one way to get everybody back, and that's reduce detention or build a detention facility. And thus far, I haven't seen a desire to build a detention facility. That was recommended by, I believe, the Hogan Commission back during the Douglas administration. Proposed that if Vermont was going to build a new facility, it'd be a central detention facility to take the detentioners out of the so-called prisons and let them do their work with those sentenced offenders. And I don't think I need a report to say that.
I was looking for, I don't know if the committee had information as far as the current numbers as of today, but currently, according to the information I received this morning, the total population is 1,395. Of that, 119 are female. There's 1,276 male. Out of state is 114. And we have, you mentioned detention, Senator Sears. As of today, it looks like the total detention population is 522. Of that, 19 are females who are in the federal population, 65 are males who are in federal. So out of that 522, 84 of them are federal detainees. In the state detainees, we have 393 men, 45 women, for a total of 438 detainees in the state system. And I actually went back and I'm aware that that this committee was talking about women's correctional issues. And so I went back and looked at the women's number and the female number a year ago on 4/26 of 23. It was 109 total female inmates. And that compares again to 119 today. And at that time, it was 45, same number as today, state detainees, and there were 14 federal detainees. And if we go back one more year before that, into 2022, it was a total of 90 female detainees, 26 of whom were pretrial and 8 of whom were federal detainees. And so the numbers have gone up in the past 2 years for the female population as well as the number of detainees. And those are issues that certainly we're aware of in terms of the detainee population. We need to address those cases through the backlog so that the cases are disposed of and we reduce the detainee population, whether it's through acquittal or a sentence, we move them on to the next phase.
That detention population is up by more than is males out of state from the COVID era, which was in the 300, 320.
Yeah, when I started, it was lower.
Yeah, so clearly the detention numbers are driving the out-of-state beds. And whatever you can do to lower detention numbers would result in fewer people being out of state.
Well, it's certainly our hope.
That's my argument that the report is unnecessary.
Well, it's our hope that what we can do is continue to utilize the resources that we have and hopefully gain through the session to reduce the backlogs by being able to process the cases. And that would ideally reduce the pretrial detention numbers, which would have an impact on these types of issues.
Yeah, it might be helpful if at future Joint Justice Oversight Committee meetings, the Corrections Department give us an update on those numbers at the meeting. And just, I'd have to remember to put that as part of the agenda to talk about the numbers and how we're progressing. We're going backwards on detention. But there's obviously, anyhow, is there anything else? I don't want to hold you from your plane.
No, nothing further at this time.
Are you driving?
I'm actually taking the train.
Well, good for you.
We're doing Northeast Corridor Amtrak.
Nice. I love Amtrak.
Yeah. So
it's always interesting how you can get there 5 minutes before the train leaves and still get on. With an airplane, you got to be there 3 hours.
And their Wi-Fi is pretty good too.
Yeah, when I go to New York City, if I count in the time that it would take to fly to New York City versus taking Amtrak from Rensselaer and driving an hour each way, I've saved 2 hours on the trip down and trip back. So a total of 4 hours traveling time versus the plane. You just, as long as you're there 10 minutes before it leaves, you get a comfortable seat.
I know the other individuals who were at the conference from Vermont, from other stakeholder groups, they did fly, and my thought was, it's a wonderful opportunity to sit there and work straight for 5 or 6 hours on the train.
Well, I can brag about the train from Albany down. It's beautiful along, the Hudson River and all that.
Yeah. Well, let's hope it's a good trip back up on time too. We've got our fingers crossed.
All right. Well, good.
Have a great day and a nice weekend, everyone. Take care.
You too. See you in Vermont next.
We'll see you next week. Take care. Bye-bye.
Thank you, Judge.
My pleasure.
Next is Carrie Brown, the Executive Director of Vermont Commission on Women.
Thank you.
Hi, Carrie.
Good morning, everybody. Thank you so much for having me. For the record, I'm Carrie Brown. I'm the Executive Director of the Vermont Commission on Women, and I really appreciate the opportunity to weigh in a little bit with some of our thoughts about the overall process for building a new facility for women in Vermont. I have some sort of general things that I want you all to be considering. A couple things that are specifically about this bill, but more that's just sort of general. And I recognize that some things are going to fall under your purview and some things not so much, but I think it's important to just kind of be aware of the full context. So we have long prioritized the goal of improving conditions for women involved in the criminal justice system. We have a policy statement that we've had for many years that I'll just read to you so you know sort of officially where we're coming from. The Vermont Commission on Women supports legislation, policies, programs, and initiatives that provide women equality with male prisoners in facilities, programs, services, and geographic placement, while also considering gender-specific needs and the needs of the children of imprisoned women, as well as community support systems upon release. So kind of covered everything here. We've been working on this for many years in collaboration with lots of different folks around the state. We were part of the Incarcerated Women's Initiative a long time ago. We've collaborated with Women's Caucus on public education and advocacy efforts. Some of you may be aware of a white paper in 2012 that was published that we contributed to. This paper was written in response to the initial move of the women to the Chittenden Regional Correctional Facility. And we worked with our partners to outline numerous concerns, many of which still remain today, 12 years later, such as an ailing physical plant and limited opportunities to work and build marketable skills. And some of those concerns, the fact that they have not been resolved is a big part of why there's been a decision to build a new facility, because there are just things that are never going to be able to work at that facility no matter what. And so, you know, we're pleased that DOC is recognizing that the legislature is recognizing that and trying to do something better. We have worked with many, many partners, some of whom you've heard of or will hear from, people who work directly with incarcerated and formerly incarcerated women, such as including the Department of Corrections, but also Vermont Network Against Domestic and Sexual Violence, Vermont Works for Women, Mercy Connections, Lund, the ACLU, Vermonters for Criminal Justice Reform, many others. We've held numerous listening forums in the facility. We've received many letters from women who are housed in the facility, and we have heard consistent concerns about the future of incarceration for women in Vermont. And I want to share some of those with you and then some recommendations that we have in response to those. So with the frequent shuffling of women from one facility to another, some really valuable programs and opportunities have been lost. For example, in Swanton and Windsor, Vermont Works for Women ran a modular home building program where the women in the program actually built an entire home that was then became housing in the community. So it's contributing to the housing shortage, which is only much worse now, as well as teaching really marketable skills to the women who are in that program. That's not something that there is physical space for at CRCF. And so that hasn't happened since then. There was a program called Girl Scouts Beyond Bars, which brought girls into the facility to spend time with their mothers and other relatives. Vermont Works for Women was able to bring a version of their Rosie's Girls Trades program for girls into the Windsor facility that allowed women to spend time with their daughters and their relatives. And then in previous facilities, the outdoor space was much more prominent in the women's day-to-day life. I don't know if any of you have been to the Windsor facility, but the difference between the physical plant there and anywhere else is really remarkable. The separateness of the buildings required people to be outside on a regular basis, as well as just the contrast to CRCF is dramatic, which again is one of the reasons why replacing it is a good idea. But then also we've heard a lot about the culture at CRCF, which has contributed to rampant incidents of sexual misconduct affecting both inmates and staff. And from what we understand, that culture has not significantly changed since it's been brought to light a few years ago. And a new building will not change the culture. And so any replacement of the facility has it's not enough just to think about what the building will look like and how it will be constructed, but what's actually happening inside the building is what needs to be considered. And so this is kind of a common theme that goes through our recommendations, and from what we've been hearing from our partners is that we need to think about what the needs are of the people in the facility, what the programming needs are, the service needs, and then build a building that is based on that, rather than trying to build a building that then we fit our programs and services into. And it's a little bit of a different way of looking at building design, and DOC and BGS are definitely taking some of that into consideration, but we are concerned that there has not been nearly enough input from people who are most directly impacted by the changes that are being considered. So we really, at the beginning of this process, we advocated very strongly for a process that pulled in stakeholders of all kinds. So providers, service providers within the facility, but also people who work in the facility, currently incarcerated women, formerly incarcerated women, the families of currently and formerly incarcerated women, the people who are working with the women after they come out in the community. And I don't see that process has been particularly robust, particularly when we're talking about bringing in the actually incarcerated or formerly incarcerated people. I think there's a lot of room for a lot more input from there. And we, Judge Zone was just talking about detainees, and I'm so glad they had the actual numbers for today, because you can see that we're talking about roughly half of the women who are at CRCF are detainees, and that has been true for a while. And when you have a population of 100 or a little bit more than 100, and half of them are detainees, and you're talking about building a new facility that has reentry and the more secure facility, and you're going to be dividing people up, and only there's pretty strict criteria for being part of the reentry facility. Detainees won't qualify for that. So that's half of the people right away who are not going to be part of that. And then there are other restrictions as well. So it's a pretty small number of people, relatively speaking, who will get to end up in that reentry facility. But everybody has very specific needs. Many of the people who are detainees are going to end up getting a sentence that they have already served in the time they've spent being detained, and so they'll be leaving and never having had the opportunity for the reentry services in the reentry facility. And in fact, maybe, not getting, who knows what kind of programs and services they have access to, because they don't know if they're going to be, they don't know when they're going to get out. They don't know how long they're going to be there. And so there's a lot of people whose needs need to be considered specifically, including also people who are there for very, very long term, or people who are there for the rest of their lives. That we have heard from people who've said, I've used up everything that's here. I've done all the programs, I've taken all the classes, I've done it all, and there's nothing left for me. And I've got another, 15 years to go with nothing left for me. So all of that really needs to be taken into consideration. We are very concerned about the number of beds that are being proposed in the plans. And I understand that there are good rationales for building kind of modularly, so you might end up with a lot more beds than you actually need. But we really need to be thinking about the goals of Justice Reinvestment 2, specifically about the one that says improve public safety in Vermont while creating immediate opportunities to reduce recidivism and achieve long-term savings by reducing contract bed needs significantly. And there are a lot of factors, obviously, that go into how many people are incarcerated, but the plans for the new women's facility are, I think they're talking about like 180 beds or something for a population that is currently just a little over 100, half of which are detainees who really need to have I agree with Senator Sears that we really need to figure out a way to address that much better. So our specific recommendations, some of which you might be able to address in this committee, some of which maybe not so much, but I'll just let you know anyway, are to require a planning process that is currently happening, but to require it to prioritize those who are most affected by incarceration, including those who are incarcerated and their families, facility staff, and the providers who are working with them. And to direct the planning process to include research and recommendations into meeting the programming, health, and transitional needs of residents and designing facilities around those needs. So including, as I said before, programming and services tailored to specific populations. At the same time, we want to caution against creating a situation in which the best services and programs are available inside the facility. So we don't think the best services that people can get are by being incarcerated, and instead invest much more significantly in building community supports that reach people both after they're released, but also before they're even sentenced or have contact with the criminal justice system. We also would love to see, and this is something we've asked for before, a formal study committee to research alternatives to incarceration. So there are many, many, many models out there in the rest of the states and in the world for alternatives to incarceration. We've done some in Vermont, but we really could use a lot more. And so we would really love to see the legislature create a study committee that would come up with some very specific recommendations.
Do you have written testimony?
I do, yes. I'll send it
Yeah,
along.
if you send it to me. Senator Bohowski has a comment or question.
I do. Thank you, Carrie. My question, and I know you often have a great amount of data, is around treatment furlough, and if that would be an alternative to incarceration that would help decrease our women's population and get them into the community supports in a significant way. If you have, I don't know if you have numbers, and I know it's, but.
Yeah, I don't have anything on that specifically, but that is exactly the kind of thing that a study committee could look at. We have in the past done a lot of research about alternatives to incarceration, but I got to tell you, nothing within the last 10 years or so. So it's pretty outdated. So it needs to be updated.
Well,
so
we've done legislation, Justice Reinvestment 2. Some of the other legislation we've done is resulting in fewer people being incarcerated. I don't want to leave the impression that we haven't done anything in the last 10 years. I think we've been one of the leaders among states in reducing prison population. That's what we're getting criticized in some quarters for right now, quite frankly.
As a follow-up to that, it's my understanding that a significant number of the women who are incarcerated are struggling with substance use disorder and or mental health challenges that might be better served in the community on a treatment program. Is that correct?
I am sure that's true. I don't have exact numbers, but I'm sure that's true. I do think that it's important to recognize that Vermont has done a good job of reducing the numbers, and particularly with women. And that's another reason why we're kind of concerned about building a new facility that serves almost twice as many people as are currently incarcerated. So that's a good question.
I believe the Network Against Domestic Violence and Sexual Assault has figures showing a large number of the offenders who are currently under supervision, female offenders, were either sexually assaulted or abused.
Absolutely.
I mean, they've been victims in their lives. I'm sorry, we interrupted you, Carrie, and I want to.
Yeah, that's fine. I only have one more recommendation, which actually is something specific in this bill. The Family Friendly Visitation Study Committee is looking in part at geographic placement of inmates and possibly putting them in places that are closer to their families to facilitate family visitation. As you're considering building a new facility for women, there will only be one. And so they're all going to be there. And so I would wonder if you could ask the Family Friendly Visitation Study Committee to include recommendations about the location of a new facility for women that takes into consideration making it as accessible as possible for families. A facility in Chittenden County, very accessible to lots of people in that part of the state, not really so much to people from Bennington or Brattleboro or the Northeast Kingdom. And so a more centrally located place may be better. There are lots of factors to take into consideration, but that is something that study committee could take under as part of their mission. And that is all I have. I'll send on the written testimony to you.
That's a good point. The problem is I would prefer something more centrally located, representing the southwest corner of Vermont. But when you're talking about reentry and other things, the services need to be there, and the services seem to be in Chittenden County. If we put it in the center of the state in Randolph, for example, what, you know, other than the interstate, I don't know what you got for services. With all due respect to Randolph and nice little town.
It is a nice little centrally located small town.
Yeah. So those are difficult choices. I do agree. So thank you very much.
Thank you. I appreciate the opportunity.
Any other comments, questions? Falco, a few minutes. Senator Norris and maybe somebody else may be leaving for an Eagle Scout ceremony at 11, and so don't think he's ignoring you.
I will not. I appreciate the heads up, but I understand you all are busy and have a lot going on at this time of the year. So for the record, my name is Falco Schilling, and I'm the Advocacy Director for the ACLU of Vermont, and appreciate the opportunity to talk very quickly about the underlying bill, and then generally about some of our concerns around the proposed construction of a new women's facility. I will say we do support H876 and a number of the initiatives contained in there. There's nothing that's a red flag about that legislation at this point in time. And we support the goals in there, including expanding earned time to those on parole, attempts to improve transition to reentry by making planning easier from a medical perspective, setting improved visitation, especially for the male population, and trying to find more equity in that across the state, and expanding some of the similar programs we've seen, like Kids Apart, to others, and trying, you know, as a father myself, that's something I think is very important, and maintaining those connections between incarcerated men and their families, I think is very important. So we really appreciate that, as well as studying the idea of how to eliminate the use of out-of-state private prisons. And I think you've gotten to the heart of one of the questions that's there is, we look at the population that we have now and the population we had before the pandemic. And overall, we've reduced the number of incarcerated individuals by about 300 people. But we've seen, and that's including a 400-person reduction in the sentence population, but an increase of about 100 people in the detained population. So I think what you were saying is, and this also goes to some of my testimony relating to the women's facility, I do think that there needs to be a concerted effort to look at how can we effectively reduce that detained population.
Maybe the study would be better and more productive if it looked at how to reduce the detainee population rather than how to reduce the out-of-state population, because it goes without saying, you reduce the detainees, you'll reduce the out-of-state.
Yeah, and I think it's a shared goal. Yeah, I think it's a shared goal that I think a lot of folks across this building, from across the political spectrum, would like to see us moving away from out-of-state prisons in general. Yeah. I know that we do have a higher level of concern about the use of for-profit prisons.
Understood. But I would merely point, as I did earlier this morning, that when we used Pennsylvania, I had more complaints from Vermont offenders about Pennsylvania, the state of Pennsylvania corrections programs, than I have about core civics. So, I mean, I understand the concern about a for-profit and the way it looks and et cetera, but then go by the complaints from the offenders.
Yeah, I completely agree. I don't think that just moving to a public out-of-state prison in any way solves the concerns that folks have. So I think that's why, you know, both those elements are considered in this proposed study.
Maybe asking Ben to reformulate the study in section 7 to one of detention, how to reduce detention numbers.
Reformulate section 7 study into how to,
what methods could be taken to reduce the detention numbers.
Yeah, I think that's an important element, but I think part of that, and I think this gets to the larger, you know, the request from Carrie Brown and others, and I think generally what a lot of us are looking for is also looking at some of the alternatives that might be available. And I in no way want to downplay the efforts of Justice Reinvestment. I think it's been doing incredible work. We've seen historic reductions, and as I've said, especially in the sentence population, that is where I think that work has really taken a toehold and has made an incredible difference. But as folks who are involved in that process, remember, I think detention was not a major focus, largely because they saw that the churn and a lot of the increase in the population we were seeing was from the post-conviction, the post-incarceration, furlough processes and other things. So looking at both, how do we reduce the number of detainees, and there's a number of ways to look at that, but also as Senator Bohosky has raised a number of times, things like could we look at increasing the availability of treatment furlough beds, which is a structure we have under our current statutes, but as I understand is not utilized in part because, as much as it could be, because of the lack of available facilities that can provide those services.
When the eye care facility in Bennington comes online, you will reduce some of that population who are infirm, who are nursing home eligible. I think that's gonna, I don't know whether it's 10 or 25 people, but it's gonna reduce some of that population. Secondarily, if 195, HS 195, the bail bill, passes in somewhat the form that we passed it, I think it will reduce detention numbers by having other methods of supervising people in the community. I could be completely wrong and it'll increase the numbers, but the idea is that you have alternatives like electronic monitoring, home detention, pretrial supervision of people and getting them services, et cetera, that you reduce the detention population. But obviously the bill hasn't passed and it's still in the House and we'll see what happens. But I do think those are encouraging signs, so I'll mention that.
Yeah, I genuinely hope that if 195 passed, that it has that effect. I think we're gonna have to monitor it closely and see what impact it does have. And that hopefully those alternatives are actually used as alternatives to incarceration as opposed to another layer of, surveillance or intervention. But I think that's not something that's easy to legislate. You're putting the tools out there and we're gonna have to pay close attention to how it works. Senator Bohosky asked a question just about in terms of like the mental health and substance abuse needs or classifications within our population. I think it's helpful that the commissioner has testified that 70% of the population is on some form of medication for mental health, when generally 16% of our population is on some sort of medication for mental health. And then 60% of the population is on medication for some form of opioid use disorder, when generally 1% of the population is on some sort of it has opioid use disorder in general. So when we're looking at the population, we have high co-occurrence of these disorders, and then we also have an overrepresentation. So as we look at things like treatment furlough, I think that might be another area where if we can build up more effective systems, we might see alternatives to incarceration. But to move, I know there's a number of other witnesses behind me, so I don't want to take up too much time, but to speak more directly to our concerns about the proposed women's facility. This is something we've been engaging with for the last 5 years, and our concerns have remained pretty consistent from the start. Our concerns have been the size of the facility compared to the number of people who are incarcerated. As we've seen more specific proposals, the level of security that's going to be required. So as we look at the ratio of people in the reentry facility versus folks who are in more typical secure beds, what that ratio looks like, and trying to make sure that more folks have access to that reentry facility and a less secure setting, because I think that is both appropriate in terms of security needs for much of that population and also can help improve rehabilitation. And then also looking at how we can move towards the vision that has been articulated for that facility sooner and not wait until we have that facility. One of the main goals that has been articulated is trying to get folks working in the community, connecting them with employers now, and connecting them with employers that can help build that bridge post-incarceration. So I think one thing that we're also asking for is looking at how do we start implementing those types of programming now and not waiting until there's some sort of new facility 5 to 8 years down the road and saying the facility is what's going to create those opportunities when we do have we can start instituting things like that through policy and statute earlier. So those are some of the high level concerns. And then generally, as Carrie said, I think we've consistently asked for some sort of more formal study around what are the ways to reduce the number of beds that are needed for this population. And I think we've touched on a number of the points there. I know Senator Bohosky has raised a number of these potential points as things we could look at within that type of study. So I would leave it there for now.
Good. Any questions?
Mr. Chair, I have a question for you.
Yeah.
If So this may not be a fully formed idea yet, but, you know, my understanding is that, you know, with the general population, there's 80 beds for Gen Pop, with the reason being that they have to be built in these pods that are 40 beds and then 40 beds in the other one. Would it be a tenable idea to have a plan that as we are hopefully lowering our incarcerated population, that one of those pods over time transitions into a reentry pod? And so instead of the 30 reentry beds, we'd end up having 70 down the road.
Well, I believe there's been a discussion in the planning of the idea that the reentry facilities would be increased. I think right now the proposal is for a 30-bed reentry facility with the opportunity to add 50 additional beds to that, if I look at the plans that have been proposed. So I think focusing maybe more on the reentry side initially, and trying to lower that number of secure beds might be a way to go, but I think you can dig into some of those plans more. And I will just generally say, we are overall concerned that this is going to be an expansion of our prison footprint within the state. When you look at the numbers, it's 20 more beds than we currently have and 30 more beds than the max population that we've seen since the start of the pandemic.
I think, so what, and I'm not trying to oversimplify things, but what I'm not wrapping my head around fully is the fact that, you know, this proposal, while there are more beds, those beds are intended to be used for things like acute mental health cases, reentry, and, you know, some of the other special categories that I can't remember off the top of my head, which I think shifts away from just having a huge facility of a lot more general population beds. So, I mean, so I'm trying to reconcile that in my head with what you're saying. I mean, do you have any thoughts?
I think the simplest way I can put this forward is what we've heard over and over again is that when you're building the facilities, you want to look to plan to build the facilities about 15% larger than your general population, right? That's what we've heard in testimony a number of times. Pretty consistently, the population has hovered around 115. So that means you're looking at more like a 135 bed facility as opposed to a 185 bed facility. And that would then take into account some of the fluctuations that we're seeing, but that also doesn't take into account things like whether or not we should be holding federal detainees, whether we can reduce our detainee population, and a number of other factors. So, you know, applying that to more of the average daily population than what we have seen since COVID, as opposed to pre-COVID numbers, I think gets you just applying that same ratio, and what we've heard is best planning practices gets to a much lower bed number. And that's one of the points in the letter that us and other stakeholders sent to the commissioner. I think it should be listed on your page under our testimony as well. But just kind of simple math, looking at that, that's a concern of ours.
I apologize, I didn't write down the numbers that I've heard floated around about the current population, but what percentage of that the detainee population, and maybe the actual number, generally speaking, is held because they haven't posted bail?
I don't think I have specific numbers on the folks who are there and are available.
I think next week we could ask Corrections Department, they're scheduled to come in along with the commissioner, and can we get statistics on the detention population who's
Yeah.
Generally in Vermont, the majority of individuals are held without.
Yeah, but
We can get a point in time count for you.
yeah, if you can have that, I think next Wednesday, the commissioner's scheduled.
Can I ask for another piece of data that they bring with them, and that is the population that is held because they don't have adequate housing?
The D1 population, yeah, you do that.
So I guess my questions weren't really for you, Paul, I'm sorry.
And so I think out of deference to the other witnesses that you have scheduled, I'd be happy to step down
Thank
and
you.
answer any questions and provide anything more in writing.
If you
that'd be
would
helpful.
get to me any thoughts you have on a study that we discussed earlier about the detention population, both the male and female.
Yeah.
Be happy to work to set a more realistic study up than the current set.
Yeah, and I agree. I think looking at this through joint justice over the summer would be a good use of time, just because it's impacting everything. And then when you look at the female population, there's a disproportionate number of detainees compared to even the male population within the state. It's usually hovering around 50 to 60% when the male population is more on average like
Back when
30
I
to
worked
40%.
Gonna get me in trouble. Back when I worked with male and female troubled youth, it always seemed like the females were allowed to get into more trouble with social issues than the males before DCF took action. And then, once they did, they put the hammer down on many of the girls, and the girls would exhibit behaviors like running away, etc. So there's been a definite, back in those, and I'm talking now 30, 40 years ago, there was always a definite, in my mind, effort to avoid until the last minute or until it got bad, dealing with the behaviors. Just a little tidbit from the 70s and 80s.
Well, thank you very much for the opportunity, and thank you.
All right, our next witness is Jenna Asaf, and Jenna has provided us with written testimony that's on our webpage.
I brought printed out
And
copies.
we bought copies.
Oh, you guys also,
We also
I actually
have
already
them.
made quick two copies.
Oh, okay.
We have lots of copies.
Ben's on top of it, okay.
Well, now we have copies for everybody.
Hello, everyone. My name is Jana Ossoff, and I lead the Vermont Free Hair Campaign for the National Council for Incarcerated and Formerly Incarcerated Women and Girls. Thank you so much for the opportunity to speak before your committee today. So I will share, we appreciate the effort to improve conditions and programming for incarcerated people. However, we feel that H876 could go further. The bill includes many positive aspects like providing IDs, improving healthcare and earn time, but some elements should be expanded. We especially wish to see the study around transitioning away from for-profit prisons broadened to look at how to begin transitioning away from the prison system overall. We are incredibly grateful that policymakers are working to bring our community members home, but the legislation does not seem to acknowledge that state-run prisons also generate profit. We privately contract with companies to provide medical services. We charge for phone calls to family. We charge for hygienic products, decent food, and other items that can help with people's well-being. We recommend the committee include language in the study to assess different ways to end the practice of profiteering off incarcerated people. It is essential to recognize that there is always someone making money off the backs of people who are in prison. Regarding the replacement women's prison, I will share a few concerns here. Prisons are inherently traumatic, and it is disconcerting that legislators are claiming that the new prison construction will be trauma-informed. We know from experts that this is simply not possible. And this idea stems from this new concept of carceral humanism that has deeply embedded itself in the minds of decision makers, not only in Vermont, but across the country. The notion of carceral humanism recasts and conflates the prison system as a social service provider, and this further entrenches resources and powers within the system, taking away vital services in the community and invisibilizing the trauma those in prison experience. This is problematic in many ways, but significantly when the new prisons often fail to deliver on promised programming and services, which we have witnessed firsthand in states like Illinois and New York. Policymakers also continue to employ the argument that a replacement women's prison is necessary due to the suffering faced by those who are currently incarcerated, but this same logic does not seem to apply to efforts to decarcerate. The prison construction could take at least 10 years. What can we do now to move people out of the women's prison now? We have multiple options for decarceration and more to explore, which I've shared with the House Judiciary, but I feel it's worth repeating for the Senate committee. At the height of the pandemic, we released approximately 1/3 of those incarcerated in CRCF to reduce crowding and slow the spread of COVID-19 and witnessed no significant impacts on public safety. Could those efforts be replicated? We also have around 16 people who are 50 or older in CRCF, and we could pass elder parole legislation so they can be in a more appropriate setting. And considering it can cost almost double the amount of money to incarcerate an older person due to healthcare needs, this should be of the utmost priority for us. You heard from the judge earlier about where our pretrial detention rates, and that could easily take off a lot of pressure on our system. And we could also more heavily utilize primary caretakers, or Act number 104, which diverts parents, and that could save our communities from significantly more trauma down the line and possibly divert future generations. Looking back at a study in 2014, UVM found that nearly 40% of incarcerated Vermonters had had at least one parent incarcerated during their youth. There's a clear trauma to prison pipeline here. We can also transition people who are incarcerated due to mental health or substance use disorder to more effective programming. There are incredible community-based supports that, if expanded, could prevent incarceration and be a place we could move people to from prison. To share a few programs, we have Alyssum, which is currently a 2-bed home that is a residential crisis respite and hospital diversion service funded by the Vermont Department of Mental Health. It is free for eligible Vermonters and peer-run. There is the Pathways FACT program, which is a model intended for people with serious mental illness who are involved with the criminal legal system. They usually have co-occurring substance use and physical health disorders. Their needs are complex, and these disorders are often undermanaged and further complicated by involvement with the prison system. And Soteria House, which is an alternative living environment for Vermonters experiencing an early mental crisis. And these are just to name a few. They most likely have data on success rates and cost savings for the committee to reference, and it is probably fair to assume that these alternatives cost less than $95,000 per year per person. Regardless of whether a new prison is built or not, almost everyone currently incarcerated in CRCF will return to our community with only 4 people, I think around 4 people, serving life sentences. We have small, manageable numbers here to begin experimenting with alternatives and create a model for the rest of the country to follow. In closing, I stress we need policy changes that divert, decarcerate, and expand alternatives to ensure we are supporting women and all people to build stable lives. Until we invest in the community, we will witness the same outcomes. We encourage you to continue involving directly impacted people in these discussions and explore if those who are currently incarcerated can testify virtually. It's imperative that we center those affected by incarceration so we do not continue to make the same mistakes. Thank you for your effort in this matter and dedication to ensuring all perspectives can be heard.
Thank you.
Thank you.
Any questions or comments? Do you have some other, Rose?
Yeah, we have Tiffany Harrington with us as well.
If you want to introduce, or Tiffany Harrington? Okay.
Hi.
Good morning.
Good morning. I'm really honored and grateful to be here today to talk to everybody. I don't have a whole lot to say that hasn't already been said, and that can't echo what's been said and has been being said. I'm here as a formerly incarcerated person, so obviously I'm directly impacted, and obviously this issue is very close to my heart. I was under supervision for 15 years. I'm a single mom. I have 5 sons, and they were obviously very impacted by my incarceration as well. And when I think about all of the other options that could have been taken instead of incarceration, it kind of makes me sad because I think about the lives that were forever altered and probably will be forever altered generations down the line, in my family anyway, and for friends that I know too. I think about all of the women that I was really close with that have died since I knew them. There's a lot of issues that are not being really addressed properly right now, while incarcerated, that are supposed to be getting addressed. I would say like most of the women that are incarcerated do have substance abuse issues and or mental health issues, and that, I mean, it kind of goes without saying. And a lot of them also, I don't have the statistics, but I just know from personal experience.
Go ahead.
Sorry, I would say I just know that, and most of them also have had a lot of previous trauma, domestic violence, sexual assault, violence in their past.
Would you mind sharing with us a little about when you left the Chittenden Correctional Facility? What it was like, how much were you prepared to go back to the streets or not prepared? Can you share that?
Well, I'm somebody that I like to think of myself as pretty savvy. I'm not really, but I also will say this, I was not prepared at all. I wasn't prepared to go back to the streets when I was released. I will say this on one hand though, most of the times that I went to prison, I was there for lack of residence because I couldn't afford an approved housing,
Yeah.
So when I would go back from jail, I would get to the streets, I would have no clothes, I would have no shoes, I'd have nothing. So basically I'd have to start over every single time. And that is very, very problematic. I mean, you can't imagine how exhausting that is to do time after time, especially when you're sitting someplace where I would sit there pretty much almost a year every time for lack of residence. So 15 years I was under supervision. My first 6 months were my initial sentence, okay? Other than that, I probably did another 5 years just on lack of residence. And that's disgusting. I've had 2 children I've given birth to 2 children while incarcerated. And having to go back to the prison after that was horrendous. But bottom line, yeah, when I left the prison, it's usually, you're kind of just they say, oh yeah, we'll contact this person or contact this group. And, you do, but they really don't, they're not there. You know what I mean? They're just not really there. So you're not really set up to succeed when you leave. I don't think personally, from what I've seen from other women, other friends, I haven't seen them set up too well. I had a friend leave last year. I went and picked her up and stuff, and she was so poorly prepared that she pretty much immediately went back into a life of things that she shouldn't have been, really an unsafe thing. So I don't think that what's being done is enough. I do think that there needs to be more things happening in our community. I have a rapport with my doctors, stuff like that. Sorry. And I think that if you can continue to foster those relationships with your community providers, you're in a lot better shape than just going in and out of a facility and having to try to.
If somebody were to receive pathway services, I can't think of the word of it, but I know pathways.
Pathways is great.
So if you receive that, you would have a better chance of staying out of trouble when you get out.
Yeah.
Versus just being out there, having to buy all new clothes, having to buy all new, not even having shoes.
Right.
So what I'm getting is the theme about why wait 10 years or 5 years or whatever to implement the reentry strategies that have been discussed. Why wait for a new facility? Try to implement the reentry strategies now.
Try to avoid having a new
particularly to help. Pardon?
I'm sorry to interrupt you.
No, go ahead.
I was saying try to avoid having a new facility if you can avoid it. You know what I mean? Why spend that money if you can put that money elsewhere and actually help people?
Yeah.
Go ahead. I'm sorry.
Anyway, Senator Bohowski.
Yeah, no, my question actually is to expand on what ways right now that you think we could invest in setting people up to better succeed, if there are things that we could be doing differently, regardless of a new facility. So you might have been going there anyways.
It probably was, and I apologize. I didn't mean to interrupt you or anything. Sorry. I get excited. But I think that Pathways is an excellent program. More money was put into Pathways, and there's more. Pathways does housing, so they do a program called Housing First, and they work with not just inmates or former inmates. They also work with mental health people in the community as well. So if you can, if there's more money put into funding Pathways, let me tell you, that is an amazing program. I've seen a lot of positive things come out of that. If there's more money put into even COSA, Circles of Support and Accountability, I'm sure you guys all heard of COSA. Mm-hmm. They do a lot too, and they do have a housing component for people that are incarcerated or formerly incarcerated. So maybe if there's more housing options, like through COSA, you're not gonna have people on the streets. And then I think what happens is when people don't have housing, I think that they are put in such a bad headspace and like kind of in a bad position. I can't blame them really. I mean, what are you supposed to do after a certain point? You begin to feel really helpless and hopeless. And I've been homeless before myself, and I know what it felt like. And it was not a good time, you know. It was really hard for me to keep together. I had to because I had my kids with me. So like I had to keep together. But I was on supervision at that. But yeah, there's programs like that that would just be, I mean, that would astronomically help. There's not that many people, like the population is actually not that large, really, in the scheme of things, if you think of it.
No.
You know, I mean, why can't we help those people? Like, there's just not that many. I mean, why is it that there's all of these other people and programs and things that are getting all this money, and at the end of the day, you've got mothers and aunts and grandmothers and, you know, dads.
To answer that question, you
Yeah.
kind of have to go down to the other end of the hallway.
Right.
See all of the people asking for money for all kinds of good reasons.
Right.
And then you go upstairs to the governor's office and all the people asking for money for good reason. And
Oh, man.
it's a never-ending demand. And for years, corrections was underfunded for a variety of reasons. And we've tried to bring back some sanity, but I think that the suggestion today that would leave me as the best one is that it's time to implement the reentry strategies and not wait for a new facility.
Absolutely.
So anyway, Senator Hashim and then Senator Lasky.
Thank you. Thank you for your testimony. I appreciate it. I think my question might be for DOC. And this is my fault for being out of the loop on the policy, but are we still incarcerating people for lack of an approved residence?
Yes, I think last time I checked, there's about 40 to 50 folks who do not have an approved residence. And the most common types of that are individuals who are facing domestic violence charge or convicted of domestic violence.
Yeah,
Sorry, what was that?
I've always felt that the term is the wrong term and you should change that term.
Mm-hmm.
Because approved residence just means to me, oh, no, they can't go in over the bar. You know, that's not an approved residence. The bar is too close, they'd get a substance use problem.
The nomenclature could use some work, but
yeah, it really could, because it indicates that, wow, we couldn't find housing that's appropriate.
Are you talking about people being held without bail?
These are individuals whose residence that they would like to return to. For some reason, the state has deemed not appropriate. So, for example, there's a victim living in that residence. Oftentimes, individuals who've been convicted of sex crimes, for example, a lewd lascivious, and there's a child in that residence, and so it makes it not appropriate. So the state cannot responsibly release that individual to that residence.
Are there people being held without without an approved residence, but for non-violent crimes?
I would imagine, if possible, I would have to get the data for you on that.
Okay.
We can pull that for next week.
If they're non-violent crime, this is my opinion, and I'm not trying to open up a can of worms here, but, you know, if somebody's being held because they don't have access to an approved residence and it's for a non-violent crime, that's something I'd be happy to explore and ideally do away with.
Yeah, I think, ideally the department would like to make every effort to get folks back into the community, but we realize they're successful. And I would just note, Speak Pathways has been an amazing partner along with Burlington Housing Authority. And every year, there's actually money left over in those grants that we give to Pathways and Burlington Housing Authority and other transitional housing providers because they don't have enough beds. Because they can't find enough beds in the community.
I'm asking for information on your request.
Oh,
could you next week provide us with deeper dive on those 60 plus people?
Yep, absolutely.
Why they lack approved residence? Go ahead.
and one more question, actually, to follow up on something you had mentioned earlier, the reentry strategies. I can imagine, well, I don't have a lot of in-depth knowledge about incarceration, but are there reentry strategies that can be implemented that don't require the construction of buildings that we can implement sooner?
Absolutely. I mean, it's one reason why we're expanding our work with the Turning Point Centers across the state. We have a pilot in Rutland that's been very successful, working directly to bring peer coaching behind the walls of Marble Valley. That's expanded to Springfield. It's expanding to CRCF right now. We're working with Burlington Turning Point. We've also just received $500,000 from BAA to do that work, and we're pursuing federal funding as well. Something we spoke with Senator Welch's office about last week in Washington.
Thank you.
Senator Bowski, and then we'll try to wrap up.
My question, are we releasing people from incarceration to homelessness?
That is the policy of the department is not to do that.
So if someone has no housing, they would be housed.
We would try and establish transitional housing through our pathways from Housing Authority Partners.
And if they were on supervision and lost their housing and became homeless, would they be returned to the facility?
That's not, our staff would make every effort to make sure that didn't happen. That would be, I don't think, a reason to violate someone, but we can bring in our.
Okay, that would be really helpful for me.
Same reason that if someone has a positive UA during analysis screen, we wouldn't return them for that.
That's helpful.
Terry, thank you very much. I'm
No, I
sorry.
wasn't done. To your point, Senator Sears, I think we do have to really look at all of the different ways that we implement reentry before or regardless of facility, but that's gonna take money. And I also think we need to really be talking more, and I know that you've worked so hard on restorative justice, but looking at the other end and looking at investing in diverting people before they ever make it into the facility. What I've heard from you and from other incarcerated individuals that I have spoken to is that being incarcerated is incredibly traumatic. And and we know from the statistics that incarceration actually increases the rates of people engaging in more criminal activity. And so I want to think, yes, how we invest in reentry now, but also how we invest in diverting people so they never end up in the system to begin with.
So I have a question, Dave. Given the time you spent incarcerated, it appears that the age of 50, which I don't think is very old anymore, by the way. How many are older women who you were incarcerated with? Over 50 is fine number for that number, but
There's pretty much like a whole unit of like older women. It was a smaller unit, but they made like a whole unit for them pretty much. So I mean, there are some, there's not, obviously it's not like the majority, but there are older women there.
I kind of had a vision of the population being a lot younger.
A lot of it is, but there is, I would say I'd say roughly, I mean, I don't want to say this, but I don't want to know the numbers, so I don't want to.
Yeah, no, I understand.
But I mean, I would say they had like pretty much their own unit, and they were like, there was enough, you know what I mean? There was at least, not a quarter, I think, but like you could definitely.
There was enough to make it a whole unit.
Right, it was just one of the smaller ones, yeah.
Senator, that information is all available on the DOC website.
Yeah.
But I would say, so I think it's like 6% as of March 31st is over the age of 55, which is the sort of national cutoff for geriatric individuals within the carceral system. But I will say we've seen a massive expansion in that population in the last 20 years. About a 300% increase in the last 2 decades across all genders.
One of the things that strikes me when I visit a prison, and it's been a long time since I've been to Burlington, but one of the things that strikes me is a number of people who are no longer, or at least don't appear capable of serious harm to anybody, physical harm. I talked to a guy that I knew from Bennington last time I was at Springfield, and he recognized me. I don't know how he did, but he recognized me, and we took a conversation. He'd been in the program, and he was in a walker. He was using a walker to even stand up in the cell. Now, how much danger is that person going to be to somebody, and yet he's isolated for his own protection because he is so vulnerable. And having some other alternative for him is not going to endanger public safety.
We mentioned the eye care beds, which we're very excited about coming online.
Yeah, but
We'd like to
I'm
release
not
those.
sure, if that solves the entire problem, but
No,
anyway,
we
for
have,
somebody like that, it certainly would.
right, we have about 20 to 30 folks that we would release today if there's
Really?
a nursing
That
facility
number?
that would take them. But because their justice involved, some of our staff sometimes make 40 to 50 calls trying to find a nursing facility that will take folks in DOC custody.
Yeah, I know, I mean, nobody wants grandma next to a sex offender, right? Well, maybe you,
Well, I mean, if the sex offender needs a walker and can't move around,
Right.
I don't think they're a danger to grandma. I think that's more about culture shift and understanding what is corrections for. Is it to punish people or is it to protect safety? And if they're not a danger, they're not a danger. But my question,
this is the final question.
all
We
right,
have
and it
to-
is for Isaac, and you don't have to answer it today, but I'm wondering if it would help with some of those 20 or 30 people that you would release tomorrow, but people don't want them because they're in custody, if we expanded hospice or elder furlough or release, if that would allow them to no longer be in DOC custody, and it would make that easier.
So it's a good question, and I think, we've approached this before, and the crux of the issue is not the legal mechanisms that we have in place, or the treatment furlough, medical furlough, it's the lack of beds in the community.
Okay.
So it's a community issue.
So we need to make big investments in the community.
It could also, it could also be back to the improved bed
Mhm.
situation. For this individual I was just discussing, I'm sure there's no approved bed in the community, and he's got a very long sentence for a sex offense, which he deserved, in my opinion, but on the other hand, he's no longer a danger to anybody.
Thank you so much.
Thank you very much. We're adjourned, and we'll see you next week. Have a good week.